LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about exercise in pregnancy. So, there hasn't been as much research as you would think for exercise in pregnancy, and it turns out for years during my practice, I would advise patients to restrict their exercise, to keep their heart rate under 120 beats per minute, or maybe it was 130, it's been a little while. It turns out that that target was picked arbitrarily, and it sounded like a sound and reasonable conclusion, but it wasn't based on a lot of experimentation. So it's hard to do studies on pregnant women, and there are less formal studies, but I can tell you some general guidance that I've found to be useful in my practice, and also some of the hazards and problems that I've found patients encounter with exercise in pregnancy. So first of all, overall exercise is great. It's excellent for you, it's healthy, and it also does help keep you in better shape for pregnancy, to give you better endurance to be able to make it through the labor and delivery process. It keeps your weight in check, can reduce your risk of high blood pressure pregnancy, diabetes of pregnancy. So we do recommend exercise in pregnancy, but with moderation. It's not time to join the Olympics. It's not time to push yourself to your limits. I recommend that you tone down the exercise somewhat, that you, rather than pick an absolute limit for the heart rate, take whatever your max exercise was before and reduce it by at least 20%. Also, be careful about adequate hydration. If you get dehydrated when you're not pregnant, you don't feel so well, you don't perform so well, but you can still manage. When you are pregnant, if you get dehydrated and you push it a little, you can pass out. Or be careful about getting adequate nutrition and get hypoglycemic, which is low blood sugar. Again, if you're not pregnant and you push, you might feel a little dizzy, a little nauseous, but you can pass out when you're pregnant, and you can fall and hurt yourself and injure yourself. So a fall or an injury is no fun at any time, but if you're pregnant, it could lead to miscarriage or preterm delivery. So what I recommend is, let's say you're somebody who jogs, you jog for an hour, to make sure you have adequate hydration. If you're sweating, make sure you have replace it with Gatorade or similar electrolyte drinks. If you're doing really vigorous exercise, you should use something that has glucose in it, but be careful about your weight and balance using too much glucose. That's the Gatorade with calories versus the Gatorade Zero without calories, okay? Take breaks. So if you normally go an hour, maybe break it up into 2 half-hour segments with a break and a drink and a bathroom break. Also, dehydration can lead to preterm labor, especially later in pregnancy, which is why you want to stay adequately hydrated and not push a long exercise adventure. So I'd rather break it up into smaller ones. Another thing to consider is the risk of an injury or fall. By definition, your balance is not as good when you're pregnant. As you get bigger, your belly is moving out, your weight distribution is changing, plus your ligaments and tendons are a little more loose with the hormone relaxin. Put that all together and you are more vulnerable to a fall. And if you fall, you could cause some serious consequences. So be careful about asymmetric exercises, like wouldn't play volleyball, okay? I wouldn't bowl. Yes, bowling, in my experience, because it's a heavy object and asymmetric, I've had many patients who've done that asymmetric exercise and hurt themselves, hurt their backs. And then you can't take the medicine that works the best to treat your discomfort. Advil, ibuprofen, non-steroidal anti-inflammatories, you can't have those during pregnancy. So that's an asymmetric exercise I would stay away from. Also, horseback riding. You don't have full control over the horse, the jostling, but falling off. If you fall off and hit the ground, you could cause a miscarriage, you could cause a pregnancy loss or preterm labor. Have I seen it? Yes. Okay, so that's the type of thing to stay away from. Some mild lifting of weights, I would go to increase reps and lower weight. Whatever your normal weight limit is, decrease it a little and make sure you have good form for weightlifting. If you watch Olympic athletes, they make sure and blow out when they're making their biggest effort, push out. Because if they hold their breath, they can cause hernias. Well, in pregnancy, or for women in general, it can cause prolapse. It can increase your chance of having your bladder falling or uterus coming down over time. So you want to use proper breathing. Try to use your legs to lift things instead of your back. Overall, avoid the asymmetric ones. There are some yoga is a good exercise, but there are some unusual movements or maneuvers that are asymmetric and much more difficult, and perhaps higher risk when you're pregnant. If you are talented and experienced, I have known some patients who are talented and experienced have done well, but those who have less balance already in coordination have had more troubles with yoga. But there are plenty of movements that are symmetric, like the downward dog exercise or stretching, that are awesome and excellent. But using the asymmetric, super difficult balance requiring maneuvers, I probably would stay away from those. So you get the take-home message here. Avoid falls, avoid exercise and activity that puts you at risk for falls or for injury that require enhanced balance. Avoid pushing yourself to your full limits. You want adequate hydration. You want adequate nutrition. Eat before, have enough glucose on hand so you don't get low blood sugar, okay? Take that in mind and know that overall, with some good common sense and toning it down a little, exercise is extremely valuable in pregnancy. So I hope you found this information of use. Please leave your comments. Thank you.